Hello and welcome to Unshamed Kentucky's September webinar, Combating Opioid Use Disorder Stigma with the work in the workplace and the Cultivating Transformative Leaders. My name is Michelle Juma, Project Management Specialist at Shatterproof and coordinator of the Unshamed Kentucky webinar series. And to include all the fantastic information we have for you today, we've extended the webinar from 1 hour to 75 minutes. So get those questions ready, but feel free to introduce yourself in the chat before we get started and add your name, your organization, what city you're joining us from. We really like to see who's attending for today's event. This event is being recorded and will be available on the Unshamed Kentucky website, along with a copy of the presentation. All attendees will be muted throughout the event, so please use the Q&A button at the bottom of your screen to ask questions. The chat is also available for general commentary, but it won't be moderated as closely. Our interpreters will remain spotlighted throughout the event, but if you're having any trouble viewing them or our speakers, I suggest changing your screen to gallery view or side-by-side gallery view by selecting view at the top corner of your screen. The Unshamed Kentucky webinar series is a partnership with the Kentucky Opioid Response Effort and Shatterproof. I'd like to give a special thanks to the Kentucky Office of Vocational Rehabilitation for providing ASL interpreting services at this event and all of the following webinars in the Kentucky series. I'll now pass things over to my colleague Chapin Leatherwood and encourage you to complete the post-event survey that will pop up on the screen as you close out of today's event. Chapin?
Thank you very much, Michelle. My name is Chapin Leatherwood. I'm the Senior Program Coordinator working on the Unshamed Kentucky campaign. I reside in Nashville, Tennessee. Kentucky is very near and dear to my heart and our personal long-term recovery. I'm going to provide a brief overview of the Unshamed Kentucky campaign, what our approach is, and then we'll get moving right along into some of our presentations today. So our campaign overview is that Unshamed Kentucky is a 12-month evidence-based behavior change intervention aimed to reduce the addiction-related stigma held by Kentuckians. This campaign is delivered by Shatterproof, which is a national nonprofit. We are committed to ending the addiction crisis in the United States. We do this in partnership with the Kentucky Opioid Response Effort, or CORE, and the project is supported by CORE and funded through a SAMHSA grant. We have three main goals of our intervention, and that is to increase knowledge about opioid use disorder. And we really want to encourage people to know that recovery is not only possible, but probable with proper support. We want to improve the attitudes towards those living with or in recovery from OUD. And we want to develop Kentuckians' understanding of the disease. Let people know that addiction is a disease, not a choice, and provide people with the tools they need to better support their loved ones living with or in recovery from OUD. And we get questions often about what does evidence-based mean? How do we do this? And we do it through kind of a three-pillar approach with community connection, story sharing, and education. We will survey in a state prior to launching our campaigns, connecting with these community-based organizations that will provide a needs assessment and let us know what are the areas that we have to address. And then throughout the campaign, those same community-based organizations and a committee appointed by Shatterproof in the Unshamed Kentucky campaign of all people who reside in the state help us keep a pulse on the campaign. What are the areas that we're hitting? Where can we improve? And how is everything being received in the state? With story sharing is really important to put a face to the disease. People who are in recovery, people who have friends or family that they have lost to the disease, friends or family that are in recovery, treatment services, providers are able to really let folks understand the human side of this disease. And this creates a much better connection to those that are affected by OUD. And our education piece is one, these wonderful webinars that Michelle helps organize and put on. It helps us use the knowledge from our CBOs and the knowledge that we've used from the communities to figure out what are the exact messages that we have to put out. And then we will create these webinars on those topics to help educate the general public. And that is a brief overview. I know it's the Cliff Notes version. If you have any additional questions, you can find them on unshamedky.org or by reaching out to me directly. Moving on into our webinar that we have today, Combating OUD Stigma Within the Workplace and Cultivating Transformative Leaders. We're going to have a presentation by Dr. Jason Roop. Dr. Roop is, I don't want to, toot your horn too much, but just a tremendous example of what recovery can bring into somebody's life. He has a master's of theology with a specialization in leadership, has been appointed on multiple committees and really helped drive change within Kentucky. Dr. Roop has done some incredible research on the positive qualities found in people that are in recovery from a substance use disorder. And with that, I'll pass it on.
All right. Well, thank you, Chapin. I appreciate the introduction, and I'm really glad that everyone is here today. And what I'd like to do over the next few minutes in sharing this research, I believe that the purpose and the goal of this will be to change how addiction is seen and understood. And it brings together two topics which aren't normally grouped together. And that would be, of course, addiction and leadership. And over the course of the next few minutes, we will, number one, identify the leadership traits that are found in addiction. We will also describe how people in recovery can transform organizations through their leadership ability. And we'll also lastly describe how this understanding applies to workplace culture, stigma reduction, and aligning purpose with our recovery efforts. And so as I began this study actually started in 2019, and I was 7 years in to recovery. And I just began my PhD journey at Campbellsville University. And as I launched the dissertation or the research, I was presented with a question. And the question that I had in mind that would become the thesis or the point of the study was this: is when working with people in addiction and in recovery efforts, is the goal to completely change everything about the person that's in active addiction, or is it something else? Is there something else going on? Or are there good examples or good traits or good qualities about that person that can be identified and strengthened? And so this study, again, it began in 2019. And so I used what's known as inductive reasoning, which just looks at examples of what's going on in our world. And then from those examples, it builds an understanding or a theory. And what I'd seen in treatment was pretty fascinating while I was there. Of course, I was in active addiction 17 years, and I was in residential treatment for 1 year, lived there, and I began to notice some things all around me. And I noticed that there were other people in that environment, in treatment, that were thriving. They were positively impacting others around them, and they were initiating much good for others, and they were transforming the environment around them. And so the question which guided this research was this: do people with substance use disorder have leadership traits? And so I want to point out too that the goal is not to identify those leadership traits only in recovery. It's starting at the ground level, so to speak. It's talking about those of us who are in active addiction. Is it true that there's leadership qualities within the functionality, the thinking patterns, and the behavioral patterns of such people. And so this study covered a 3-year period. It included 15 participants, and some of the participants, I'll just mention some highlights. There were 3 New York Times bestselling authors that participated in this study, a top executive from the Hazelden Betty Ford Clinic in Minnesota, an Emmy award-winning TV personality, and a 4-time winner of the James Beard Award given to the world's top chef. So a pretty interesting participant pool, very diverse, with equal representation of male and female, spread out geographically throughout the United States. And so over this 3-year period, the instruments that were used were intense, in-depth interviews, observations of the participants in their normal daily life or their normal working environment. It also included a focus group, which consisted of a few participants that were 6 months into treatment at a residential treatment facility. So these interviews were carried out over a 3-year period, the observations as well over a 3-year period, and the focus group. And the purpose of all this was to identify attitudes, personality traits, and character traits of the participants. And so to answer the question, do people with substance use disorder have to determine that and to define that, I used 2 leadership approaches, which are transformational leadership and authentic leadership. And so transformational leadership is known by 4 aspects. And so that includes, and they invest in the individual, words align with action. Transformational leaders are able to motivate and inspire others, and they empower others. And so the other leadership framework was authentic. So using 2 approaches to leadership to determine what an effective leader is, transformational and authentic. And authentic leaders are self-aware, they're honest and transparent, they're open to criticism, and we consider how, or authentic leaders consider how their decisions affect everyone in the group. And so what you're looking at now, this is a concept map which describes the study basically. So if you'll notice on the right-hand side of this diagram, you've got leadership. And above leadership, you have transformative leaders, those traits or those aspects I just went over. And then at the bottom, authentic leadership and those aspects. Those 2 boxes move into the leadership box so we know what an effective leader is. And then on the other side, on the far left-hand side, you see addiction. And so this is going to be people who are in active addiction, people with substance use disorder. And in the middle is where those traits begin to emerge. And so if you'll notice, there's several listed here, and we'll hit on the top 6 in just a moment, but down the middle are those shared traits between people with substance use disorder and great leaders. At the top, we've got post-traumatic growth. This is the personal and professional growth which occurs after the crucible events in life, after traumatic events, right? And so people that are in recovery have come through the crucible of addiction, and it further strengthens and develops a lot of traits within them, completing the task. People with substance use disorder, I remember when I was in active addiction, my only purpose in life, it seemed like each day, was to complete the task of getting the next drug. And that's also a great trait, a good trait by leaders of organizations, that they focus on completing the objective or the goal of the business at hand. And then of course we see persistence, resilience, we'll get to this in just a moment as well, determination, adaptability, self-awareness, and authenticity. And so from this, the top 6 traits which emerged from all the data that was collected from all of our participants over a 3-year period, using interviews, observations, and a focus group, the top 6 traits which emerged from our participants, which had all been in active addiction and were currently in recovery, were authenticity, tenacity, empathy, empowering or empowers others, self-awareness, and post-traumatic growth. Now, these traits, when combined, they tell us a story, and it's a story that most of us are very, very familiar with. And so we all know, number one, is that people in addiction typically tend to go all out. I know from my personal experience that I went all out. I would take the amount of chemicals, of drugs or alcohol, whatever it would, and I would take it to the next level, so to speak. And anything I did in my life, I would go all out. And actually, this continues to this day. It's just purposed and focused in more socially acceptable methods and manners, and lends itself towards productivity. But in active addiction, that's a characteristic that we typically find, that we just go all out. And that's actually who you want leading your organization. You don't want a complacent leader leading others in your organization. You want a leader who is going to step up right to the plate, and they are going to do everything they can to not only meet expectations, but to exceed expectations. And so we see this, these 6 traits, when combined, they describe quite well probably the most effective leadership style that our society knows today. Now, the negative side, of course, to going all out is kind of what I just covered. It points to the fact that we typically go all out in terms of amount of chemicals and obsessive behavior on multiple fronts, but there's also a positive side. And the positive side is just kind of like I shared. You want somebody leading your department within your business or your organization that is going to go all out, to not stop at anything, and to keep churning the wheels, so to speak, and to actively recruit and engage others to do likewise. And so we see that, number one, people in addiction typically tend to go all out. Great leaders do as well. The second thing that we notice is that people in addiction and recovery can bounce back from anything. And so we see this resiliency that's developed and cultivated. And on the negative side, this does have a negative connotation as well. That, and if I'm being honest, and I ask for your permission to do so, but I recall that there was a lot of times in my own life that I've flirted with death, yet I still went back for more. And that's just the negative functionality of this trait, that we bounce back and we don't let anything stop us. And of course, that has a negative side when used in a negative context and with damaging substances which destroy our mind and our lives. But on the positive side, we keep getting back up, even in the face of failure, even in the face of setback. People in addiction and people in recovery get back up time and time again. And this is who you want leading your organization. You want resilient leaders that are not going to allow a hurdle or an obstacle or a setback organizationally. They're not going to allow that to set them or deter them off course. They're going to keep coming time and time again, keep getting back up time and time again. When the market says that everything is crashing, people like this are able to stay in the fight or the game, so to speak, and keep marching forward. And so we see that. That's a reflective characteristic of people with substance use disorder, as well as effective leaders. We keep getting back up after we've fallen down. And the third point of our story that these traits kind of paint is that people in addiction have an incredible ability to impact others around them. They can change the environment quite quickly and quite effectively. They quickly and effectively impact the attitudes of others, the behavior of others. And again, on the negative side, we've seen this, at least I've seen it, and probably most of you have as well. This can start with like just creating a negative mood in the room. People in active addiction or with substance use disorder typically can change, and unfortunately too often to the negative side, the climate or the environment within the room. And when left untreated, what ends up happening is this ability to impact others will fester and grow to the point of other family members building their lives around the person in active addiction. Pretty soon, people in or family members of those in active addiction, they'll center their entire lives around that person. And not saying that's bad nor good. I'm just saying it's the kind of the nature of our world. That's the way these interactions take place. That's the negative side. But on the positive side, this is positive construction. People in recovery have this tremendous ability to draw others in to their world, right? They can draw others in, and they're able to draw them in, but in recovery, allow and empower them to become successful. They draw others in, and they begin to help others or point others to the way of believing that they can accomplish anything. And so this changes everything. This is who you want leading your organization. When you've got a negative workplace culture, you want someone in recovery that can step in and bring inspiration and motivation and optimism. And this is what recovery is about. It's about building back something better than its original condition. And so we see that quite a bit from the study. And I just want to quickly move through the data here, and this will be made available to you at the end of this presentation. Here are all the traits that were collected, identified, and gathered, and they are ranked on the left-hand side, authenticity at the top, and then it moves through tenacity, empathy, empowering others, and self-awareness and post-traumatic growth like we just covered. There are a lot of fascinating traits left that I've not pointed to or mentioned. There's going to be future studies which incorporate and include those and expound upon those. This is a pie chart kind of showing further the breakdown of those traits identified and described. This table kind of shows on the left-hand side the leadership dimensions for those two leadership theories, and on the right-hand side, you can see the corresponding codes or corresponding personality traits and character traits of our participants or people with substance use disorder. And so I pulled up a couple quotes here that you can see. The first quote is from participant 4, and this quote was coded as self-awareness. And it says, people in recovery have to be self-aware and accountable. I see that as a blessing because it makes us better people. So if you were to tell me that I could have a whole staff of people who are focused on getting better, a better version of themselves on a daily basis, I'm going to ask you how I can find more. And our second quote comes from participant 2, and this was coded as post-traumatic growth. And they shared, it's like a superhero that goes from the dark side to the good side. They didn't lose their superpowers. They just stopped using them for crappy reasons. And so what these findings mean, of course, that people in addiction and recovery tend to have natural qualities which position them to become highly effective leaders. This also advances our understanding of how natural characteristics play into choices and behaviors of active addiction. It highlights areas of focus for treatment and recovery. Very interesting material there that we can go over potentially later. And finally, it suggests leadership development be integrated as an effective component in the model of treatment. So when we're in our recovery efforts and we're facilitating various modalities and approaches to sustainable recovery, we need to include leadership development because it will continuously engage those of us and those traits within us that are positioned well for leadership. And finally, what employers can do. And so typically employers look maybe at people in addiction or recovery to fill kind of lower tiered level positions within their organization. But this understanding from this study actually causes us all to consider, what about people in recovery filling those leadership roles in your organization? Because they're going to be authentic, transformative leaders. They're going to change the environment. They're not going to let anything discourage them. They're going to keep getting back up after they get knocked down, and they're going to go all out, right? And so consider using people or employing people in recovery for those leadership positions. And I do want to mention that this does not mean a lowering of standards. So if you're an employer and you're committing to hiring people in recovery, this by no means is a lowering of your standards at all. And yes, people in recovery, we are entirely grateful for any opportunity we have, but we offer so many benefits and just a tremendous advantage to any organization that you're actually raising the bar. You're raising the standards on what not only you accept and tolerate, but what you encourage and strengthen. So I would encourage employers to do that and to develop team building activities that are centered. And these activities don't need to include exclusively people in recovery. This is applicable, applies to everyone within an organization. These traits, resiliency, tenacity, authenticity, right? These traits can be identified and amplified in any business, any organization, and doing these workshops and these conferences will further help establish and cultivate and develop the leadership capabilities of your entire organization. And then finally, openly discuss recovery in the workplace and incorporate regular recovery meetings. And so finally, before I turn it back over, I just want to say that this understanding absolutely serves the purpose and meets the goal of lowering stigma, right? This helps dismantle the stigma that's associated with addiction. It changes how we see people in active addiction with substance use disorder. It allows us to see the powers that they have that are just being hijacked by the drugs. And once we can see those powers within the person, apart from the chemicals and the drugs, then we've identified hidden treasures which will lead to recovery, and hidden treasures which will greatly benefit your organization. And so thank you very, very much for your time. I believe now we're going to open it up maybe for some questions.
We are actually going to hold off questions following our panelist conversation, but thank you so much, Dr. Roop. I'd like to bring forward Chapin to introduce our panelists today.
Thanks, Michelle, and thank you, Dr. Roop. On the questions, feel free to fire those questions off in the chat box, and we will get through those as we continue with our panel discussion. I'm going to invite our panelists to come off mute at this time. Our panelists are Ted McCoart of Isaiah House, who is the Director of Public Relations, Natalie Menon, who is a Director of Programs and Health Strategies with the Kentuckiana Health Collaborative, and Mr. Mike Riley, who is a Human Resource Director of the Bluegrass Area Development District. Can I get a quick yes from the three of you if you're off mute and able to hear us?
Yes.
Yes.
Yes, sir.
Sweet. I got three right there. if we can start with Ted. Ted, would you like to give a brief introduction of yourself?
Yeah, absolutely. So my name is Ted McCoart. I am the Director of Public Relations at Isaiah House. A little over 2 years ago, in June of 2020, I began my recovery journey actually at Isaiah House after 10 years in active addiction. I am a native of Eastern Kentucky, grew up in a small coal mining community, Van Leer, Kentucky, graduated from Morehead State University, and later found myself in addiction before discovering recovery at Isaiah House. And today I'm able to, I've found my purpose in what I want to do, which is help others find their recovery process and to be a part of something like this, to destigmatize that for individuals like me and for others is just a super cool thing to be a part of. So excited for this panel.
Thank you very much, Ted. And I will move on to Natalie, if you want to give a brief few sentences about yourself.
Hi, good afternoon, everyone. It's great to be here with you. Natalie Menon, Director of Programs and Health Strategies with the Kentuckiana Health Collaborative. We are a multi-stakeholder coalition that works to advance high quality, affordable, and equitable healthcare. And part of the way that we do that is through empowering employers to optimize the care that their employees receive. And we have had many years of experience with the Kentucky Opioid response effort and empowering employers to support their employees through prevention, treatment, and recovery from substance use disorder. So I'm excited to get into a little bit more of that conversation with our panel here today.
Thank you, Natalie. And Mike, I'm going to move on to you, and I'm going to actually pose the first question to you. So if you would like to provide an introduction of yourself and lead into types of workplace policies that enhance stigma.
Okay, so Mike Riley. I'm the HR director with the Bluegrass Area Development District. Like Ted, originally from Eastern Kentucky. I'm actually from Perry County. Went to Morehead State. So Ted, we may have crossed paths and didn't know it. Prior to working in HR, I was a program development manager for the Bluegrass Local Workforce Development Board, and did a lot of work with helping to create our Transitions to Transformation program, where we have worked with employers and recovery centers across our 17 counties to help create successful pathways for individuals to get back and get to where they want to be. And it's been a wonderful journey. Myself, in March of this year, I looked at 23 years of being sober. So as we all know, recovery happens. And so to move into the question, I guess, about policies, successful policies. And, one of the things that we've seen in working with our employers across the region, and currently, I'm very proud to say with the local workforce board, we have over 160 employers right now that we have active agreements with to provide transitional employment opportunities across the Bluegrass. And, we work closely with them on creating policy to create ways to allow for assistance for employees, to create ways that doesn't have to be a stigma, that it's just something that we can take care of and treat as we would anything else that happens to pop up, whether it be a medical issue or any type of issue. So we really work with employees to create open communication, open dialogue, so that it doesn't have to be something that's a secret to discuss. And we've also worked closely with the workforce. The Kentucky Chamber's Workforce Center has really been a instrumental part in us getting to employers and getting a lot of these policies changed.
Thank you, Mike. I'm going to open it up to all of our panelists now. If anyone has a answer for the questions that I put forward, just feel free to speak up. One of the concerns is confidentiality. Confidentiality is important for employees with SUD when they're seeking help in the workplace. How can employers address those concerns and help?
It's a great question, and certainly a concern that we do hear from employers quite frequently. There are a number of need to consider HIPAA and other legal privacy stipulations that are out there. But I think the biggest recommendation that I would have for employers is really to remember to operate on a need to know basis for employees who have been diagnosed with substance use disorder or currently seeking treatment. This is a chronic disease. So just as an employer would operate in addressing a chronic disease for any of their other employees, they should apply those same mechanisms to their employees who have substance use disorder.
Thank you, Natalie. Another concern that employees or employers may have is we know that return to use can be a frequent occurrence with those in recovery. How do you handle it when that happens in the workplace, and what systems are available to employees?
I'll take that one, unless you want to go for it, Mike.
Go ahead.
So one thing that we see, especially as Isaiah House, us being a second chance employer and hiring many people who come through our program or have been through other recovery programs, is just the importance of once someone has relapsed, making sure that they're surrounded with a wonderful support system through different things like success coaches. I believe it's important for employers and organizations to utilize success coaches within their organizations. Those are really key. So that way, when that person has the relapse and they come back, they can have someone to help almost mentor them or coach them through as they return to a normal workflow. I also think that it's important to have an open door policy within your organization. So that way, if someone feels that they're on the verge of relapse, they may feel comfortable with coming in and having a discussion with their supervisor, with their manager, with whoever that may be. So that way that they can go ahead and begin some initial steps to address that, because there is a prelapse is a thing. Once that thought enters our mind, it's really hard sometimes, especially if our toolbox isn't full of recovery things that we can easily let that become an obsession and it take over. So I think that having an open door policy with management, with supervision, so that way you can openly have discussions about these things that may help prevent them.
Mike, did you have something to add?
Yeah, I was going to say one of the things we work really closely with our employers on and participants in our programs is to have that open communication. One of the things that we found is we do a team-based approach. So when we work with an employer, we have somebody from the treatment facility, we have somebody from our workforce, we have somebody from the HR department. We want to have that open communication, because what I try to make sure our employers understand is early identification of signs that you may see that there may be an issue. If we can talk about that up front and we tell employers, look, by doing this, we're not going to kick them out of the program, but we may have to sit and take a pause and say, look, maybe we need to step back from things, reassess where somebody is in their journey, maybe take a couple of weeks off from the work program to get back where they need to be personally, so then they can come and re-engage. Because what we try to get them to understand is you might not just be interrupting a workflow, but you may be saving their life. You may be interjecting, because a lot of times what I've seen personally in working in this and working in the field and working with recovery houses is when we have someone, when the employer calls us, hey, they're not coming back after lunch, or they're not showing up for this. When we call the recovery house, we're finding out, hey, they're missing group treatments, or hey, they're not showing in for check-ins, or hey, we've not seen them a couple of days. And we've actually a couple of times been able to intervene up front and have some conversations and help people get back to a safe place and get back where they wanted to be. So it's just about communication.
Absolutely. And I appreciate what both of y'all mentioned. And Ted, the concept of in recovery, right, we call it prelapse, where, because we go all out in everything that we do, that mental obsession can become so strong that you start slipping on your work. However, you may have not used for the first time since starting your recovery. You may have not picked up that first drink. So that automatic assumption from employers shouldn't always be, oh, this person is, has SUD, they're definitely using it again. But you might be able to catch those things first, because, the first thing that you do isn't always go get that drink or drug. You might be mentally obsessing over it and stuck on your couch, unable to show up to work on time or complete assignments. So I appreciate that insight, and definitely great for employers to have that open door policy, and try to have those conversations before you do pick up that first drink or drug. A question for our panelists would be, how can employers create a recovery supportive workplace and make comfortable situations for employees? How do they create that culture where folks feel like they can speak up about their recovery?
Well, I'd like to add, before anyone else does, Chapin, I think it's kind of reflective of just the entire culture, the workplace culture. When senior managers and leaders take a leadership style that is authentic and transparent, and allowing others to see their vulnerabilities, so to speak. I think in order to create and sustain an environment that is welcoming for these conversations, I believe it starts at the top. It doesn't have to. Change can come from within and from any level, but I think the quickest way to get there is to just have those senior managers and those executives kind of continually practice this ongoing feedback loop of not only like focused on recovery, but how they're doing in the market. How are they performing in sales? Where are those areas of improvement in logistics and operations? And so with the broad and wide practice to this, I believe it naturally just opens up the space for these conversations to come forward.
I agree with that. Jason, you mentioned something in your presentation earlier about talking about team building. And I think that from that leadership aspect, when using some team building resources, it's important to include everyone within those team building. I often hear some folks talk about, well, people in recovery, that are working for us, if they need like a special AA meeting or some sort of recovery focused meeting, let's just give them a block of time so that they can do that during their shift or something like that. I think that then creates that almost segments or that group of people in a way that's really unfair to them, and it's also unfair to the employees who are not in recovery. So I think that it's important to have an all-inclusive team building type things, and so through that, I believe when you're doing these team building exercises, you'll begin to see vulnerability. And I think it would be really incredible, it wouldn't be shocking to see the people not in recovery and the people in recovery begin to relate with vulnerabilities and different things that they may go through in life, which would create a wonderful team environment and a team atmosphere, and help your employees who are in recovery and not in recovery be able to lean on each other for strength through their shared experiences that they may not have even realized that they had. So I think that that's a cool tool that for employers to use, especially when considering doing team building exercises.
And these have been great points from Ted and Dr. Roop. And I just add that clarity and consistency, particularly around workplace policies and benefits and processes, is going to be just a very key tool for employers. For employees who may be in recovery or maybe seeking treatment, to know what exactly they have access to through their employer, what exactly is going to happen when they access treatment, when they may need to utilize a flexible leave policy to go to appointments or whatever it may be. Making sure that those processes are standardized and well communicated upfront to employees can be a very useful tool in establishing that culture of support and safety.
Absolutely. Thank you, everybody. And Dr. Roop, in your presentation, you talked about people in recovery having a true value for others, and caring about their fellow employees. And Ted, I think that just goes so great with what you were talking about, team building exercises. Instead of, separating people in recovery from those that are not, bringing them together. In my experience, being in recovery, when I go to meetings, I go there for the support, but what I love the most is the laughs that you get, the fellowship that you get before or after a meeting is what really helps people be together. And those, what some people might think are, silly team bonding things, really help create that tight knit team environment, which is something that I know people in recovery really value. And then Natalie, you were mentioning the policies and being upfront about what the possibilities are for someone who is seeking treatment. What are some of those positive practices that you have experience with, or an example of an organization that maybe has policies that aren't on the mainstream yet, that are setting a good example?
Yeah, great question. The first thing that immediately comes to mind is the Kentucky Transformational Employment Program that was made available through Senate Bill 191 last year, which essentially establishes a program for employers who have potential employees or current employees who test positively on a drug screening, giving that employee or potential employee the opportunity to be assessed for substance use disorder and access treatment if necessary, while retaining their position at the company, and really being a partner in that process for that person, to not only get them, the treatment that they may need, but also as a huge benefit to the employer to retain their loyal employees and to recruit employees who have all these positive leadership qualities that Dr. Roop already highlighted. So, I think that's a great starting point for employers, just to open their minds and policies around drug testing and see how they can keep employees engaged, rather than using that as a way to write people off when it's simply not necessary or effective.
Exactly.
Absolutely. And a question for anybody who may have experience with this, as we look to not separate the two groups of people who are in recovery and people who are not, someone who might not be a traditional second chance, or as we like to call it, a fair chance employer. So when I first started my recovery journey, I worked as a valet, and almost everybody there was in recovery. But I know a lot of people might be going to a place where there aren't a lot of folks in recovery, or recovery isn't a large minority, I would call it. What can employers do to educate employees on how to support each other? How do they explain or educate their employees on the addiction recovery space and how to better support each other?
I'd like to take the lead on that, and then others can add too. But just for and that's a great question. And I'll just speak to my experience when I came to work for Campbellsville University in 2016. I would imagine that there weren't a whole host or a lot of people in recovery, and come to find out there weren't a whole lot. But what really helped me is when I got here, right, coming from Isaiah House and working in public relations, I went and spoke with the president and, asked if I could continue sharing my story. And the entire administration team, the executive cabinet, were very supportive of me continuing to tell my story of transformation. And so while some employers may not be entirely familiar with all of the aspects and components that go with are entwined within substance use disorder and recovery, I think probably one of the first steps or most effective steps is that they can just encourage people within their organization to share their story. It may not be from a substance use disorder background. It may be a different type of challenge or obstacle, but just to create this environment to where people are encouraged to share their story from where they've been. I think that is a very instrumental step in the right direction.
I want to piggyback a little bit on that. So I graduated Isaiah House in May of 2021, and after graduating, I actually left for a period of time and pursued a career outside of Isaiah House. And during that time, I actually learned a lot about this because there was different things that I noticed within my new employer. I actually, through the interview process, was very open about my recovery process because I was interested. I thought it may be a job where it may, there may be some things like social drinking that would occur after hours, and that was part of the culture. So I wanted to be upfront about that. Now, however, though, once I was pretty much told that wouldn't be the case, but once I got into the job, I did realize that was part of the culture. So I think it's important for employers to be completely honest and just be very truthful when they're making those hiring decisions. I also think it's important for employers to educate those who are their employees about different trigger words and different trigger things that can happen because the frequency of whether it be in an office space, if there's alcohol regularly there, or trigger words or whatever it may be that could trigger someone to go into a prelapse state. I think it's important that employers are educated on that, and then that they are educating their employees on the different things just to be mindful of. If they're saying, hey, we're gonna embrace this, we're gonna be a fair chance employer, here's the support that we need from our employee base also. So those are just a few things that I've experienced just as a person in recovery, within the last year.
We're getting a few questions here in the chat box, so folks, please feel free to keep firing those in. Does anyone have an answer for, is there anything that someone can do as an employer to protect themselves if they're hiring folks who might have things on their background check? Is there any way that employers can protect themselves or, be able to justify making that hire and retain that person? If, say, a contract or a job listing says, must pass background check, and someone's in recovery, how would you go about navigating that?
I mean, I'll just say that with the employers that we work with, we're very upfront going into that work with our T2T program that, we have individuals that do have a variety of backgrounds. And one of the things that we've learned is working with employers, sometimes it's just educating employers about, are they doing the background check that they're doing with the things they have because they've always done it or because it's really a necessity? And come to find out, when we get them to really re-examine why they're doing some things, they'll loosen that up and they'll look at doing an individual case-by-case basis. One of the things that we try to really focus on is who we were yesterday is not who we are today, and it's not indicative of who I'm going to be tomorrow. And we work with employers, and like one of the ways we mitigate that risk is through our internship program. We pay for the first 480 hours. The employer has absolutely zero cost of that. So we give them a chance to say, look, this is the person that you can get. And, in the beginning, this started off with employers were like, okay, well, you're paying for everything, we'll take the chance. Slowly over time, what this has turned into is now we have employers that, we have a 480-hour program, and after about 200 hours, the employers are coming saying, look, we want to end the contract with you, not because the person's not doing well, but because they're the best employee we have, and we want to go ahead and hire them before somebody else picks them up. To the point now that we have employers that come say, look, we don't even want your money. We just know that when somebody's come through your program, you're working with folks, they're prepared. We just want to hire, we want to hire the folks that you're sending because you're sending us good quality people who are working really, really well. And it's just that education piece with employers to let them to see what is available, what they've been missing out on.
Yeah, and to add on to that, I see in the question here specifically around new hires. So Senate Bill 191 that I mentioned a few moments ago, I believe that's the program that the person who asked this question is referring to. That bill actually does protect protect against negligent hiring for employers for those new hires as well. So it's existing and new, but of course, all employers are different and have different stipulations to adhere to, whether they're in manufacturing or perhaps they have transportation. And, I think the unsatisfied answer to some of those questions is just to lean on experts too, to know what you, to Mike's point, may actually need to be abiding by versus what you're just doing because it's how you've always done it. So it does require some digging and, learning about your specific workplace, but there are options for almost all types of employers to break that status quo, begin bringing people in recovery into their workplaces.
And I just, one more thing I'll throw out is through the Education Workforce Development Cabinet, Labor Cabinet, there's the federal bonding program that offers bonding for employers to mitigate that risk as well. And that's something that's offered free to employers. And all of your workforce development boards have access to that, all of your programs, and that's something that's easily accessible for employers.
That's all wonderful information, everybody. I have a few more questions, and one would be, it may not always be an employee that is struggling with SUD, but it may be an employee's loved one, a family member who maybe they have to spend some extra time tending to or on the insurance plan. How do you create an environment where folks are comfortable bringing in their loved ones and addressing that?
I mean, I hate to just keep going back to this, but I think it's through communication. It's by having the discussion and taking away that stigma, to not treat it like it's a taboo subject that we can't broach, but to just address it and get it out in the open and talk about it and see the best way to move forward and just creating that honest dialogue.
Exactly, Mike. That's, and it's a common theme that keeps emerging, I think, that we can observe. It's just welcoming in those discussions, those conversations, and it's almost like an evolution of awareness or of connectedness to, and I think we're doing that. If I could just give my personal assessment of where we're moving as a society, I think organizations like Unshamed Kentucky are out front leading this, but people are beginning to shift how they see this entire dynamic. And I think not so long ago, and I know there's still a few that may view addiction this way, but they think of it as myself and those. Or they view people in addiction as a subgroup that needs to be fixed, addressed, and restored. And some of that is good and valuable, but I think the next stage of development or of awareness is to understand and to perceive that we're all connected, right? And so this takes place entirely in the workplace setting. So I think for like, when employees have family members that are caught or are in active addiction, I think the same spirit, so to speak, that's kind of out there in society needs to be reflected in the workplace and in the home, which is this understanding that we're in this together. And I'm coming to help you, not to save you so much, but because I myself need transformed as well. And so I think we're moving that direction. I think, just like Mike said, communication, just having these conversations repeatedly, consistently, like Natalie had shared. I think all of these efforts will lead to not only this outcome, to make it feel like a safe space for family members, but have a multi-level benefit.
I want to add one thing too. I think that an employer recognizing itself as a fair chance employer and then using that as a marketing or recruitment tool, I believe that there's opportunity there for a parent or a loved one. If you're a parent and you have a loved one who is struggling with substance use disorder, and maybe you're having issues with your employer with their EAP programs, their employee assistance programs, or something like that. If you see another employer who is promoting themselves as a fair chance employer, you may be more apt to think, okay, I want to go be a part of this organization. So it may be a recruitment tool also, in a sense, for employers to utilize to attract people to their organizations, just because I think that's going to take a lot of education, and organizations like Unshamed and things and are helping do that. But I think just educating the general population on what a fair chance employer is we may begin to see a lot of employers. We've already seen some, but we need to see 100% buy-in from employers across our state to really recognize themselves as fair chance employers.
That's good.
Absolutely. I think, the more vocal that people are with their willingness to hire, to be a fair chance employer, and the more vocal that they can be, the more folks will flock to their organization, and other organizations will look at the example that's being set. We do have just a few more questions that dropped in the chat box. If anyone with experience can speak to, there's a question: as a chaplain in that role, they interact with folks who are in recovery or seeking recovery. Is there any spiritual context that someone should avoid while speaking with those in search of starting their recovery journey?
That's an interesting question. I see Mike has something. Mike, I'll let you go. Yeah, that's a very interesting question. I work in a couple different arenas in the spirituality context of course, being a pastor, and then I'm also a chaplain at the hospital. I think personally, any step you can take towards that discussion is vital. I think that spirituality is a core component. It has been for me. And I'm not saying necessarily like religion and all of that. I'm saying like an awareness, a mindfulness, practices and disciplines which are regular, which kind of connect you to the broader picture. So I think in response to that question, I would avoid absolutes and certainties and move towards more of a relative or experiential discussion. And hopefully that answers the question, but I think it does, to kind of avoid the instruction that you've got to do it this way, verbatim, step by step, kind of step back from that and to make it more participatory.
That's exactly, because I'm not a full-time pastor, but I do preach and things. And my thing was going to be for people to be mindful that everybody's journey is everybody's journey. And to remember that, like you said, there's no absolutes. Even though we may see an absolute path for ourselves, that may not be somebody else's absolute path. And the one thing that I've always tried to do when serving in that capacity in my other life is to remember that the best thing I can do for someone is to share my global testimony, not just of how I became sober, but also my path to find that meaning for my life, and to maybe share with them. I'm not telling you this is the only way to do it, but I'm telling you this is the way that worked for me. This is the path that I walked on, and this is the path that helped me get to a place that I wanted to be in, and share it from that perspective of what worked for you.
That's great. That's great.
Yeah, that's a great question, and I appreciate both of you speaking up to answer that, because it's a very challenging question because recovery is so unique. So what you leave out from your context, what you speak in your context, I can think back to the very beginning of my recovery, and there were it really took just a few sentences to unlock that piece of my mind that opened me up to recovery. So I appreciate both of you speaking up on that. And then the last question that we have is if someone could speak to the balance between non-stigmatizing language and some of the best practices with appropriate language that you use specifically in Kentucky.
This is a good question. Language is ever changing. And there are a lot of great resources out there around language. I think particularly from the Substance Abuse and Mental Health Services Administration, they have some resources on, instead of using this, use that. But I think a few general concepts that you can lead with is, using person first language, a person with substance use disorder, a person within recovery, not making someone's experience with substance use disorder their whole identity. And just something that's been touched on a few times today already is just language that reinforces that othering, to separate or stigmatize any group from one another. Just be mindful of how what you say, how you say it may reinforce that. So there's a lot of specifics that you could get into for specific terms, but I think those are two guiding principles that can really help frame anything you say when having discussions around substance use.
I want to hit on something too. Jason mentioned it earlier during his presentation, and I think that is constructs that sometimes form in families whenever there is someone within addiction within families. And we see this a lot of times in communities. Like growing up in Eastern Kentucky, families become very protective of if they have someone that's within their family that may be struggling with addiction. It's a mouth shut, like lock it and throw away the key type thing. Let's not discuss it. So I think just learning some different ways to break down those barriers and the language, using language that's not overbearing or demeaning or whatever it may be, to try to infiltrate. I don't know if infiltrate's a good word to use in that, but to infiltrate some of those social constructs that have just been created through culture. It's important to try to learn that language and to be mindful of that when you're trying to relate to those individuals.
Good.
I'm going to just open the floor to our panelists if there's anything additionally that y'all would like to add before I hand it back over to Michelle.
I just want to say how grateful I am to have been a part of this. It's been a wonderful experience. If you're on this call and you don't currently follow Unshamed Kentucky across social media channels, I greatly encourage you to do so and to share their content that they're putting out. It is just some wonderful content that's breaking down the barriers and stigmas around the workplace also, but just around addiction as a whole across the state. So many incredible stories, statistics, and facts that I think that they're sharing. So I just commend Chapin and Michelle, your guys' work you're doing with Unshamed Kentucky. I'm just grateful to have been a part of this today.
Yeah, very well said. Yeah, great to be here with everyone in this panel. This was a really informative discussion, and I see the chat coming through. People grateful that they have been here today, which I would return that gratefulness and say thank you for engaging in this conversation and being interested and willing to take these steps to uplift not only people in recovery in Kentucky, but also all of our employers in Kentucky, and building our workforce resources and the positive impact that we can have as a state.
And I'm just going to echo, I feel like I'm going to say it for the third time, but just the thankfulness to be here and be a part of this conversation, and realize every conversation we have, every webinar we have of this nature is a building block, because every time we have the conversation, the next conversation becomes a little bit easier and it gets a little bit more expansive, and just thankful to have these conversations so that one day we may not have to have these conversations.
I'll wrap up and just echo what my fellow panelists have said and agree entirely that what, first of all, Unshamed Kentucky is doing is bringing light into the darkness. And so the work that's been done through this organization and everyone connected to it is work of profound and sacred value. And so it's effective, and it's showing a lot of fruit, a lot of benefit. And it's an honor for me to be able to share this today. And this is not just my research or my story. This is all of us. This is the story of transformation that we are all connected to on one level or another. And so I'm honored that Unshamed Kentucky would allow me this platform to present this, and I'm honored to be alongside this distinguished panel. And finally, but not the least, everyone who has participated, called in, dialed in today, and added some comments or just listened. I mean, you guys are doing much good, and you're doing the work of really changing kind of the trend, or changing what we've experienced as a culture, as a society over the past couple decades. We've seen like addiction grow and spreading, but the tool, so to speak, that's reversing the course begins with this open discussion, this stepping out of shame, which is what this is all about. That's why this is such divine work, if I may, but stepping out of the shame and bringing others with us. I mean, how could you not get excited about that? So thank you guys for the opportunity. Thank you guys for the participation. And I put on there the QR codes and links to the 2 published articles. There's more research coming, and I'd love to hear from you and everyone on this call, this webinar. Like the ideas that you have for future research, let me know, send them to me. I think now is the time we can continue to mobilize. This research was the very first piece to begin the discussion to place leadership and addiction within the same context. This is just the beginning. So thank you guys very much.
Thank you,
Thank you
Dr.
so
Roop, and
much.
thank you all of our panelists. I apologize, Michelle. Just I know we're coming up here quick on time. Just wanted to echo everything that was said with a sense of gratitude for being here, and everybody who showed up who wasn't on our panel, who wasn't a spotlight presenter, but your willingness to watch this webinar to learn. I know that I learned something new today, and I'm going to do the best I can to implement that into my life. And that's what makes the difference is folks being willing to learn, being willing to change your behaviors, and do what we can to support the next guy. So thank you to all of our panelists. Thank you, Dr. Roop, for your presentation, and I will hand it back over to Michelle.
Thank you, Chapin. Yes, so we have a fantastic group of panelists with us today, but I wanted to share a little bit more information for those who are interested. Folks' contact information will be included in the presentation. So as post-event materials, you can actually reach out to many of our speakers today to learn more about their work. But I'd love to highlight a specific resource coming from Kentuckiana Health Collaborative, the Opioids in the Workplace Toolkit, an employer toolkit for supporting prevention, treatment, and recovery. If you visit their website, you can also find even more resources and events that educate folks on employers and other stakeholders on substance use disorders and mental health. I'll go ahead and drop that in the chat for anyone who's interested. And I'll also bring attention to our upcoming webinar for October, which will be focusing on grassroots advocacy strategies that increase access to effective evidence-based addiction prevention, treatment, recovery, and research programs. I'll put that one in the chat as well. And one final reminder that a survey will pop up on your screen as you close out of today's webinar. But I want to thank you all for your patience, your interest, your time, and that you continue to spread some of the lessons that you learned today or news about upcoming events with everyone in your personal and professional networks. We're really happy to have the audience that we do and real partners who are interested in taking any opportunity to elevate this message. But have a great day, and feel free to reach out if you have any questions. Thank you.
Thank you all.